All right. I'm Angela Scott, and today I'm going to be doing an indwelling catheter on a female patient, and then we're also going to discontinue as well. So what I'm going to start with is my 12 safety practices. I'm going to perform hand hygiene before and after any type of care with the patient. I'm going to verify the policies and procedures of the facility. I'm going to gather up all of my equipment that I need and verify the manufacturer's recommendations. I'm going to knock on my patient's door, note the overall care of the patient. I will introduce myself, explain the procedure, and provide for privacy. I'll raise the bed for good body mechanics. I would don any PPE if necessary, and then I would perform the procedure. I would lower the bed rails, make sure that the patient had their call light within reach, and I would report any abnormal findings to the charge nurse. So now I am going to make sure that my patient is positioned properly, and I'm going to take my kit and check and make sure that it's not expired, make sure that it's all intact. I'm going to open it up and place this in the garbage, and going to set it here between the patient's legs, and I'm going to open my kit using my 1-inch border so that I don't contaminate my sterile field. Okay, this is a bit much, and away from me, and just so that stays. And I've got sterile gloves here, so I'm just going to remove these. I'm not going to use those. I'm going to take the blue drape and open this up, step back a bit so that I'm not over my sterile field. I will open this and lay this under the patient's legs and buttocks, but not going over my sterile field. Then I'm going to get that back a little bit. I'm going to remove this pad. I'm not going to use that, so I'm going to remove that. Now I am going to sterile glove. So I'm going to open my gloves. Okay, and going to pinch and place my hand in. Then I'm going to over here and place. Okay. So now what I'm going to do is, I've got my blue pad here. I'm gonna open this up, make a little space for myself, a little workspace. I've got my alcohol swabs, I've got lubricating jelly, and I've got my syringe, 10 millimeter syringe for my balloon. So what I'm gonna do, I'm going to have my kit open. I'm going to take this and I'm going to connect my 10 cc's here to my balloon. Okay, and I will set that there for now. Oops. You want to make sure that it stays connected. All right. Now what I'm going to do is take out, want to make sure that the catheter doesn't flop everywhere. Now I would open my lubricating jelly and I would put the catheter in there so that it can get lubricated. Now what I'm going to do is I'm going to open up my, actually I'm sorry, this is iodine. I'm not going to open that at all because according to the orders, our patient has, okay, sorry, our patient has an iodine allergy, so we don't use iodine, but we will use just the alcohol swabs. I would open these up and I would let the patient know, okay, I'm going to touch you. My hand may be a little bit cold, but we're going to go ahead and start the procedure. So what I would do is I also would have provided peri-care if needed on the patient before I started. So I would spread the labia and I would take my cotton swabs and I would go on the outer side of the labia majora and clean that, and I would drop that. I would clean the inner side closest to me of the labia majora, drop that. I would take another alcohol swab and I would clean the labia minora on the outer side, drop that, and I would do the other side as well. And then I would go right up the middle with a clean cotton swab and I would drop that. Careful not to contaminate my sterile field. So now what I would do is, okay, I would pull the catheter, actually, not yet. I'm gonna inject the 10 cc's into the balloon and inflate that, and I would make sure that I held that so that it doesn't come back out and refill. So now I would take the catheter out of the lubricating jelly and I'm going to insert, so I would let my patient know to bear down and I'm gonna insert the catheter. So I would insert until I could see urine coming out, and then I would just make sure that the catheter is in there, and I would hold it with this hand, make sure that it stays in there, give it a little wiggle, make sure it's gonna stay and not come out from the patient. So now what I would do is I would, like that. Now what I would do is I would take my bag and I would connect it to the bedside, and I would make sure that the patient, I would report how the patient was during the procedure and report any findings to the charge nurse. And now, since the order is to also discontinue, what I would do is I would come back into the room and I would redo all of this basically, but we're already here, so we're gonna do it now. What I would do is I would remove 10 cc's or the 10 milliliters that we put into the balloon. I would remove that from the balloon and disconnect that. And then I would have the patient, I would let the patient know that, hey, I'm gonna touch you, it might be a little cold. I would ask them to bear down and I would slide the catheter out. And then I would wrap all this in my gloves and I would be reporting again any findings to the charge nurse, and that would be it. I would clean up and provide peri-care if necessary.